Hello students, my name is Dr. Kasonga and welcome to your 5th lecture on hematology. If you have any questions, please feel free to email me or use the discussion boards on ClickUp, or you can visit me in my office at BMS 912. In this lecture, we will be discussing how the body stops a bleed to prevent excessive blood loss. This process is known as hemostasis. Blood platelets and certain plasma proteins are important for hemostasis to occur. If you remember, all blood cells start off as a multipotent stem cell, and they can divide into your myeloid or lymphoid progenitor cell. From your myeloid progenitor cell, you get your megakaryocytes, and these are what will form your blood platelets. So this image illustrates how your megakaryocyte sits in the red bone marrow. So fragments of the megakaryocyte will break off and become your platelets. So it's pieces breaking off your megakaryocyte to form your blood platelets. And thrombopoietin is important for the stimulation of platelet formation. So your blood platelets are also known as thrombocytes. And as illustrated here, the megakaryocyte is a very large cell. The edges of your megakaryocyte will break off to form your platelets. As the platelets are cell fragments, they are considerably smaller than red blood cells. Platelets have no nucleus, but may contain some organelles such as mitochondria and endoplasmic reticulum. Your platelets will also contain granules, which contain important clotting factors. So as mentioned earlier, your platelet production is controlled by thrombopoietin, and it causes an increase in the formation of your megakaryocytes. Your platelet contains granules, which contain important cytokines and clotting proteins, and your platelets are activated by damage to your blood vessel wall, and they will form a platelet plug, which is formed in order to stop bleeding so that the body can repair the damage. If you take a look at the characteristics of your platelets are very small in size, and they have a lifespan of about 10 days. You have between 150 to 450,000 platelets per microliter of blood. Anything less than 70,000 platelets per microliter will lead to a bleeding disorder and difficulty in clotting. So an abnormally low platelet count is known as thrombocytopenia, and this can cause spontaneous bleeding to occur. This can lead to bleeds that occur under the skin, that's known as purpura or petechia. It can lead to nosebleeds and bleeding from the mouth and or other cavities. This also causes prolonged bleeding whenever you suffer a cut. So now let's take a look at how your platelets are involved in preventing bleeding. So this is known as haemostasis, and it is responsible for keeping blood inside the vessels and repairing any leaks that can occur. So we're going to take a look at the hemostatic mechanism. So there are three major steps involved in hemostasis. The first is vasoconstriction, which is where blood flow is limited to the area where the bleed is occurring. The second step is the formation of the temporary blockage, which is formed by the platelets, and this is known as the platelet plug. And the final step is blood coagulation, and this is where the blood clot forms to seal the injured area and allow for tissue to be repaired. So now let's take a closer look at the three steps involved in hemostasis. So the stimulus for hemostasis is damage to the walls of the blood vessel, and this triggers vasoconstriction. Vasoconstriction is important for limiting blood flow to the area and also creating a sluggish flow through the vessel, which helps the blood clot to form. Damage to the cell wall also exposes the underlying layer of collagen, and collagen is important because it activates the platelets. The platelets will then release factors into the blood which can further stimulate vasoconstriction. The platelets will also aggregate to form the temporary platelet plug. The exposure of collagen and tissue factor is also important because it activates your coagulation cascade. And your coagulation cascade is important because it activates thrombin, which will eventually activate fibrin. And fibrin forms the stable hemostatic plug, so it will form the stable clot. Fibrin will slowly dissolve as the cells grow and the tissue is repaired. Eventually the clot will be dissolved and the blood vessel will be intact again. So now we're going to take a closer look at platelet plug formation. So how exactly does the platelet bind to collagen? A glycoprotein called von Willebrand factor is important for the adhesion of platelets to collagen. Exposure of collagen causes von Willebrand factor in the blood to bind to collagen. Receptors on the surface of your platelets can bind to the von Willebrand's factor, causing the platelets to adhere to collagen. This also causes the platelets to increase their surface area and release their granules. The granules contain thromboxane and ADP, which will recruit more platelets into the area. They also contain von Willebrand's factor to help more platelets adhere to the collagen. The granules also contain fibrinogen, which is necessary for the coagulation cascade. Fibrinogen is also important for helping platelets bind to each other to form the platelet plug. The fibrinogen will then be converted to fibrin, and fibrin polymers will form a sticky fibrin mesh, which will form your blood clots. If we take a look at some of the factors that are involved in platelet activation, so firstly, collagen. It's important for activating the platelets to begin the forming of the platelet plug. Collagen exposure is the trigger to begin the clotting process. Von Willebrand factor, as we mentioned, is necessary for the platelets to bind to collagen. A deficiency in von Willebrand's factor is one of the most common causes of bleeding disorders. Then you have serotonin, ADP, and PAF, and thromboxane. And these are all important for recruiting more platelets into the area. Serotonin and thromboxane are also important for vasoconstriction, which we mentioned is very important for hemostasis. Lastly, platelets secrete platelet-derived growth factor, which plays an important role in wound healing. So to summarize the functions of your platelets are responsible for forming the platelet plug to stop bleeding. They also release factors that cause vasoconstriction, such as serotonin and thromboxane. They release clotting factors to cause more platelets to come to the area and form the platelet plug, and they also stimulate the repair of the wound. So next we will discuss blood coagulation. As the platelet is being formed, the blood coagulation cascade will be happening at the same time. This ensures the formation of a reinforced clot that will prevent blood loss while the tissue heals. The clotting mechanism is triggered 15 to 20 seconds after an injury occurs. For coagulation to occur, it requires circulating chemicals such as your plasma proteins and also calcium, and also certain chemicals that are only released once the vessel is damaged. So these substances will be in the underlying tissue, and they will only be released once the vessel is damaged to stimulate the coagulation cascade. So the blood coagulation cascade is the third step of hemostasis, and we're going to take a look at this step in more detail now. So this is a diagram of your coagulation cascade, and it consists of the intrinsic pathway and the extrinsic pathway, which will both come together to activate your common pathway. And your common pathway will lead to the activation of fibrin, which will form your stable fibrin clot. The intrinsic pathway is known as the intrinsic pathway because it's activated by factors that can be found in your circulation, whereas your extrinsic pathway is activated by factors that are found outside of your circulation. That's why it's known as the extrinsic pathway. So we're going to take a closer look at each of these pathways. So let's start by looking at the intrinsic pathway. So your intrinsic pathway can be activated by collagen and other activators found in your circulation. And your intrinsic pathway starts with the activation of factor 12. So the factors in your coagulation cascade are numbered in Roman numerals. So XII is the Roman numeral for 12. So collagen and other activators will activate factor 12 into active factor 12. Active factor 12 will then activate factor 11 or XI into active factor 11. And here calcium plays a very important role as a co-activator of factor 11. Factor 11 will then activate factor 9 or IX into active factor 9. And again, calcium plays a very important role in the activation of factor 9. And then factor 9 and factor 8 together will then activate the common pathway. So this is the intrinsic pathway. Then you have the extrinsic pathway. And the extrinsic pathway starts with the activation of factor 7. And tissue factor, it's a factor found outside of your circulation. Tissue factor is also known as factor 3. So tissue factor will activate factor 7 into active factor 7. Active factor 7 and tissue factor can also play a role in activating factor 9, but it will also play a very important role in activating the common pathway. So this is the extrinsic pathway. It's a lot simpler than the intrinsic pathway. So both the extrinsic and intrinsic pathway will come together to activate the common pathway. And the common pathway starts with the activation of factor 10, or factor X. So X, the Roman numeral for 10. Factor 10 gets activated into active factor 10. And again, calcium plays a very important role as a co-activator of factor 10. Active factor 10 will then activate prothrombin, which is known as factor 2, into active thrombin. And that's known as active factor 2. Calcium and factor 5 play a very important role in the activation of thrombin. Thrombin will then activate fibrinogen, which is known as factor 1, into fibrin. And then fibrin with calcium can be activated into fibrin polymers. So this is when the fibrin molecules will bind to one another to form fibrin polymers, and that will lead to the formation of the stable fibrin clot. Factor 2, or thrombin, also plays a very important role in the stabilizing of this fibrin clot because it activates factor 13. So factor 13 gets activated by thrombin, and then you have active factor 13, and that plays a very important role in stabilizing the fibrin clot. So as you can see, calcium is a very important cofactor in the activation of your coagulation cascade. It's important for the activation of factor 11, for the activation of factor 9, the activation of factor 10, of thrombin, and the stabilization of your fibrin clot. So it plays a very important role in the coagulation cascade. So vitamin K is also an important vitamin in your coagulation cascade. Vitamin K is needed for the synthesis of factor 7, factor 9, factor 10, and prothrombin. So it's a very important vitamin in your coagulation cascade. Von Willebrand's factor also plays a very important role in your coagulation cascade as it carries factor 8 in your circulation. So you need von Willebrand's factor to carry factor 8 throughout your circulation, and then to bring it in order to activate factor 10 together with factor 9. So if we take a look at the factors that are important in coagulation, collagen is obviously an important factor as it stimulates the intrinsic pathway. Von Willebrand's factor, as we mentioned, carries factor 8 in the blood. So it regulates the levels of factor 8 in the blood. A deficiency in von Willebrand's factor will also lead to a bleeding disorder because you'll have a decrease in factor 8. Quinogen and kallikrein are also important activators of the intrinsic pathway, and these are found within the circulation. Tissue factor stimulates the extrinsic pathway. So factor 3, also known as tissue factor, is important for activating your extrinsic pathway. Thrombin and prothrombin are very important for activating factor 1, so for activating fibrin. And then fibrin, as we mentioned, is important because it forms your stable fibrin clot. Fibrin stabilizing factor, or factor 13, is important because it stabilizes the fibrin clot. And then calcium, we talked about the important factors of calcium in the coagulation cascade as it regulates several factors. Calcium is also known as factor 4. And then vitamin K, we mentioned, is important for the synthesis of factor 2, of factor 7, factor 9, and factor 10. So to ensure that blood clotting does not occur in the blood vessels, the body has several anti-clotting mechanisms. Firstly, the lining of the endothelial cells in the blood vessels prevents the exposure of collagen and tissue factor, and this will prevent coagulation. The continual blood flow is also important for preventing clotting. A factor known as prostacyclin also prevents platelet aggregation in the blood vessels. Prostacyclin gets released from the endothelial lining of your blood vessels. Antithrombin 3 is also a very important anti-clotting mechanism as it binds thrombin and keeps it inactive in the blood until it's ready for coagulation. Heparin is a naturally occurring anticoagulant, and it works by activating antithrombin and therefore keeping thrombin inactive. So these are some of the anti-clotting mechanisms of the body. So lastly, we'll take a look at fibrinolysis. So after the clot has formed, healing will begin. The clot is a transitory device, and it eventually must be removed and replaced with new tissue. This process is known as fibrinolysis and requires the activation of plasminogen into plasmin. So thrombin plays a very important role in activating plasminogen, into plasmin, and so does tissue plasminogen activator, or TPA. And plasma will break down your fibrin clot into fibrin fragments. So if we take a look at the factors that are important in fibrinolysis and anticoagulation. So firstly, we have plasminogen or plasmin, which breaks down your fibrin, tissue plasminogen activator or TPA, which activates plasminogen into its active form of plasmin. Then some anti-clotting factors, antithrombin 3, which we mentioned. It's an anticoagulant and it blocks certain factors in your coagulation cascade. Most notably, it prevents thrombin from being activated. And then you have prostacyclin, which blocks platelet aggregation, and it's also a vasodilator. So this is also another way that it prevents coagulation in your blood vessels. So this brings us to the end of this lecture on hemostasis. In this lecture, we looked at some characteristics of your thrombocytes or your platelets, and we also discussed thrombocytopenia, when you have a decrease in the number of thrombocytes in the body. We discussed the hemostatic mechanism and the different steps of your hemostatic mechanism, which begins with vasoconstriction, and then the formation of your temporary platelet plug, where von Willebrand's factor and collagen play an important role. And then we looked at the blood coagulation cascade. We looked at the intrinsic pathway, the extrinsic pathway, and the common pathway. And then lastly, we looked at some anti-clotting mechanisms and fibrinolysis. So this is the end of the lecture. If you have any questions, please feel free to email me or use the discussion boards on ClickUp.